Today we are here to celebrate 7 villages which we've been engaging for the last 3 months since we triggered them. And today they managed to attain the status of being open defecation free. And we are celebrating the 7 villages for that achievement.
Spencer is a health facility situated in Kibish Sub-County, the northern part of Turkana. It has a population of 5,450. Loruth serves the border of Kenya and Southern Sudan.
My call is the communities to sustain the gains. We are really telling them to sustain the gains that they have met, because when you don't put in measures to ensure that those communities remain open defecation free, then they are likely to slide back to what is status. So
Turkana has been one of our priority, because Turkana is one of the 15 counties in Kenya with high burden of open defecation. But with working with the county health department, working with the county water and other administrative departments, now we are making substantial progress in the number of villages in Turkana. We reach more than 58% open defecation free villages, including the ones we are declaring safe. Our priority is improving water, sanitation and hygiene as a key component of improving health and nutrition, ultimately the well-being of children in Turkana as well as the whole of Kenya. In this specific location, we have been working with the county health department, but we are working with the Diocese of Lodwar, the WWH, Peace Village team, a number of humanitarian and development partners, civil society partners in Kenya, supported by KOICA. It's a second phase of water and sanitation program in Turkana.
Has been a great long-standing partner in KOICA project. One of the key area that we focus as a KOICA is to focus on the wash-related projects. So starting from 2019, we started the Score 1 project, which is related with the wash and nutrition for the children and mother. And after that went to really successful achievements, we started this second phase project as well. To do so, starting from 2019, we started the Score 1 project, which we hope to eliminate all the OD, which is the open defecation, by 2030, together with UNICEF and the county government.
This is very important for Turkana County, because Turkana, more than 60% of the people in Turkana County still go to defecate in the bush. And what this means is that the cases of diarrhea that go into the health facility, and when people go to the bush instead of using the toilet, then whatever happens when they defecate, it means then children get diarrhea, and of course cases of diseases then become in the facilities. And so this, whatever we're celebrating today, is a milestone because of that. Now this project, starting last year, we've had another extension that now includes Turkana North and Kibish, and today this marks our first celebration in terms of open defecation free. We will also be constructing additional 41 bores in these same 4 sub-counties, and it's targeted to reach about 140,000 beneficiaries in the 4 sub-counties.
I believe that the active commitment from the village community members are the most positive thing that I can see, because it will not be a successful story without the commitment from the village people. I've seen the constructed sites of the toilet constructed by the village people, and it is really maintained well by the help from the community health officers as well. So the greatness of this project is of course from the commitments from the people.
Aruma de yang arakin nya kwa tiangana tare hichi tulobo sababu ya inzi tunapeleka baada ya kumaliza tunafunga ndio tunatoka.
Without their support it was not possible to reach where we are today. 58% of villages achieving open defecation in the last few years is quite substantial.
Let them know the importance of an tree, but the importance of eco disposal, which of course can be connected to it's another solid waste management strategy. So, in prevention of diarrhea diseases.
In total, we have 194 toilets that have been constructed all over this area of Loruth. And the impact is very clear from our records in the facility. We have seen a reduction in the number of diarrheal diseases that are being reported in the facility. People are getting more healthier because they are now safe, because at least everybody has constructed a toilet and the number of diarrheal diseases has reduced.
Before triggering, we had 17 toilets. And up to now, we have 194 toilets, which means the community has seen the importance of water hygiene and sanitation. At first, from May, we had 14 cases, and up to now, on those focused villages, we have 8. That is a reduction of 5. In health, any small reduction in reducing diseases is up. Apart from diarrheal diseases, eye infection, we also have a reduction in the cases, malnutrition cases.
Akatuonesha mfano kwa zile kitu ambazo sisi hatujui kama tunakwazea, kumbe tunakula maji. Alichora akakata mafijiji, alafu akaonesha mfano kuwa kina nani ambao wako na macho. Basi akalete akanunua mkate, mandazi, soda, akapungua. Wakati alipopungua hivi inzi ilitokea. Hata akaleta maji, akasema angalia, kile kitu ambacho tunakula ni hivi. Unaona hii inzi, hizi tunapokula hii chakula, sisi sote tunapata diarrhea. Kwa hivyo ni heri sisi tufanye nini? Tukasema tumechangaa, tunaanza kuchimba machoo. Tangu wakati huo ndio hii machoo tulikubali na tulizikia na tukaamini. Kwa village yangu have got 56 household. Kati ya haya we have got 44 latrine. I am teaching them to follow to another one, to dig my latrine.
Siku ngine mimi nakaa kwa mapi, nakulanga maji wa mapi, nakulanga na mapi. Unakaa mahali ya chafu sana. Kwa saa hii, kwa sagisi ilikuja, madaktari ilikuja. Alikifundisha na sisi raia. Alisema wakati wa sagisi machoo ndio sagisi. Nasema maji ushamsi. Na uweka kwa majerikani na kunyanga. Kupata dawa kwa hospitali niwekea kwa maji kwa sababu maji ya ndaka. Sio uweka mzuri. Ulichimbi ile mfupi sana, sio mfupi. Mshimba choo. Sasa watoto yangu ni 8. Saa hii malaria ya maji, malaria ya ushapu saa hii nimepunguka. Kwa sababu wa madaktari wa CHP na madaktari wengine.
Efforts on constructing the latrines, that is just the beginning of improved sanitation and hygiene. They need to continue improving.
But now I have a lot of tasks on preparing latrine, constructing new latrine, and also impact whereby the healthcare workers have been training them to
to contract latrine. And what is so impressive about this Loruth team is CHVs. One, that they are having the CHVs who are mobile, who are working with the pastoralists, especially along the borderline for Southern Sudan, whereby they can use them to influence and to bring the behavior change in the community.
We are also urging the other villages who have not attained this status to also do what these other villages have done so that we can actually move in the same direction.
Appreciate the continued support and the continued collaboration and partnership with Turkana County government led by His Excellency the Governor, who's provided a very good enabling environment for all partners to be able to support his government. The Turkana County Assembly has been very supportive in that regard. Every time we have issues that touch on children, they've been forthcoming in terms of working with us to be able to make sure that this legislation is actually passed and that we have a conducive environment, a legal and policy environment that continues to support children in this county.
Congratulations. What's the best?